Diarrhea is a common illness. It affects people of all ages. It is characterized by loose, watery stools. You may also have to go to the bathroom more frequently than usual. Diarrhea can be acute or chronic. Acute diarrhea is short-term and lasts for a few days. Chronic diarrhea lasts for a longer period. This could be several weeks or more. Diarrhea is often caused by a virus. Bacteria and parasites can also cause it. Other factors can contribute to diarrhea. These include food intolerances and certain medications. Most cases of diarrhea are self-limiting. This means they resolve on their own without treatment. However, it's crucial to stay hydrated. This is especially important when experiencing diarrhea. If you have concerns about your diarrhea, see a doctor. They can determine the cause and recommend the best course of treatment. Understanding diarrhea is the first step towards managing it effectively. By recognizing the causes, symptoms, and treatment options, you can navigate this common ailment with greater confidence. Diarrhea can be caused by a variety of factors. Identifying the underlying cause is crucial for proper treatment. Infections are among the most common culprits. Viruses like rotavirus, norovirus, and adenovirus are frequent offenders. Bacterial infections, including those caused by E. coli and Salmonella, can also lead to diarrhea. Parasites such as Giardia lamblia and Cryptosporidium are another common cause, particularly in developing countries. Food intolerances are another significant contributor. Lactose intolerance, for example, can trigger diarrhea in individuals who have difficulty digesting lactose, a sugar found in milk and dairy products. Other food sensitivities, such as those to gluten or certain food additives, can also lead to digestive upset and diarrhea. Medications, especially antibiotics, are known to disrupt the balance of bacteria in the gut. This disruption can result in diarrhea as a side effect. Other medications, such as antacids and some blood pressure medications, can also contribute to diarrhea in some individuals. Other factors, such as stress, anxiety, and certain medical conditions, can also play a role in triggering diarrhea. Irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, and celiac disease are just a few examples of conditions that can manifest with diarrhea as a symptom. Recognizing the signs and symptoms of diarrhea is essential for early detection and management. The hallmark symptom is loose, watery stools. This change in stool consistency is often accompanied by an increased frequency of bowel movements. Abdominal cramps and pain are also common complaints. These cramps can range from mild to severe and are often described as cramping or aching. Bloating and gas are other frequent companions of diarrhea, adding to the discomfort. Depending on the underlying cause and severity of the diarrhea, individuals may experience additional symptoms. These can include nausea, vomiting, fever, chills, and blood or mucus in the stool. In severe cases, dehydration can occur, leading to symptoms such as thirst, dry mouth, fatigue, dizziness, and decreased urine output. It's important to note that the presence of blood or mucus in the stool, a high fever, severe abdominal pain, or signs of dehydration warrant immediate medical attention. These symptoms could indicate a more serious underlying condition that requires prompt evaluation and treatment. Section 4. Diagnosing diarrhea. Diagnosing the cause of diarrhea typically involves a combination of a medical history, physical exam, and laboratory tests. The doctor will begin by asking about your symptoms, including the duration, frequency, and consistency of your diarrhea. They will also inquire about any associated symptoms, such as fever, abdominal pain, or blood in the stool. A physical exam will help assess your overall health and hydration status. The doctor will check your temperature, pulse, and blood pressure. They will also examine your abdomen for tenderness or swelling. In some cases, laboratory tests may be necessary to identify the underlying cause of the diarrhea. A stool sample can be analyzed for the presence of bacteria, parasites, or blood. Blood tests may be ordered to check for signs of infection or inflammation. Imaging tests, such as a CT scan or ultrasound, are not typically required for diagnosing diarrhea. However, they may be recommended in certain situations, such as if the doctor suspects a more serious underlying condition. Section 5. Treatment and management. Treating diarrhea involves addressing both the cause and symptoms. Diarrhea often resolves on its own. Supportive care can alleviate symptoms. Staying hydrated is crucial. Replenish fluids and electrolytes. ORS restores electrolyte balance. Medications can control symptoms. Anti-diarrheal medications help reduce frequency. Use under healthcare guidance. Antibiotics for bacterial infections only.